Hello everyone, it's April from Pelvic Balance. You may have heard of the term diastasis recti. It's also known as a separation of the abdominal muscles, and it's very common during pregnancy and for some women can last into the postpartum period. Men can have this as well. And I want to talk about why we can't just focus on the abdominal muscles when we are trying to heal this area. There are many factors that can be contributing to why the rectus abdominal muscles would not be coming back together, why someone still has weakness in the center of the abdomen. So we need to look at a lot of different factors when we are trying to treat this. I will focus on one of those areas right now, and that would be the ribs. Now, why are the ribs so important? Well, the abdominal muscles attach to the ribs. So if the ribs are in a different position, that can contribute to the abdominal muscles being pulled in a different direction. So let's take a look at pregnancy, for example. If you've been pregnant or you've even seen a pregnant person, you often will see how their posture changes. And often they get a little bit more of an arch in the low back, which then can result in the upper body being forced forward a little bit more to distribute weight a little evenly, as well as the growing baby pushing the abdominal contents upward into the rib cage. Our rib cage can often expand a little bit during pregnancy, and it does not always go back to a normal, average position after pregnancy. So sometimes women end up with the ribs still being flared out here. And if you have a separation of the abdominal muscles and add in that rib flare, that can contribute to those muscles being pulled in different positions depending on what's going on with your ribs. So that's definitely something that we look at when we're trying to heal that area. Now, something that you can think about is, if you are concerned about this, think about your posture. When you sit or stand, are you one that sort of thrusts your rib cage forward? If you are, try to think about tucking those ribs down a little bit. And I don't mean just sort of slouching forward. I mean still maintaining an upright posture without forcing extension of that upper back. So try to adjust your posture, because that can have a significant impact on what position your ribs are in and how everything heals. The other thing you can do is work on your breathing, because often, again, during pregnancy, we may end up with an altered breathing pattern because our lungs are not able to expand as well as they could previously. So what you need to practice is working on those deep breaths where you're really working on expanding your lungs and taking deep inhalations and exhalations. So when you're breathing, think about expanding your rib cage in all directions. So if you find that you're one that breathes mostly forward, see if you can change your breath to send it towards the back of the lungs and expand that way as well. You want to think about your rib cage opening up like an umbrella. So that's something that you can work on to help with that rib flare. Now, there are other things that we can do to help with that too. There are some hands-on manual techniques that I do with women to help improve that mobility and get everything in the most optimal position that we can. So I hope that helps. If you have any questions, please feel free to reach out to me. April@pelvicbalance.com. Thank you. Have a great day.